Hi, everyone, and welcome back to the Hair Loss Show. And in today's segment, we're going to continue with our series on chatting with experts. And it is my absolute pleasure to bring in our next guest, who's a very good friend of mine, Dr. Alejandro Gonzalez from Mexico. Alex is, like I said, is a dear friend. He's very skilled at what he does. He's a real master with long hair FUE, and he goes on to conferences and trainings and teaches people to do this particular skill set. But he's also got a tremendous amount of experience in other aspects as well, and he's really pushing the envelope in his other therapies as well. And we sort of unpack those during our conversation. So if you're ever in Mexico, Dr. Gonzalez is the one to seek out. But I hope you enjoy this conversation. I'm sure you'll learn a tremendous amount from this. So without further ado, I welcome to the Hair Loss Show, Dr. Alex Gonzalez.
Welcome to the Hair Loss Show, where Dr. Russell Knudsen and Dr. Vikram Jayaprakash discuss issues relating to hair loss and the medical and surgical treatment of hair loss in both men and women.
Ladies and gentlemen, this is Dr. Alex Gonzalez from Mexico. He's a friend of mine. I'm very honored and very happy to call him my friend. But he's also a phenomenal surgeon based in Mexico, runs the clinic, MX Capilla. And look, you've been doing hair transplant for a while. I mean, I know some of the answers to this question, but talk us through. I mean, first of all, thank you for joining me. I really appreciate you taking the time. I know with the time difference, it's late there as well. So I'm truly grateful. So thanks very much for giving up of your time for me.
No. Thank you very much, Vikram. Thank you for inviting me. Yes, I'm a hair transplant surgeon. I have more than 7 years making hair transplant. Uh,
Yeah,
that's the only thing I do daily, hair transplant and hair loss treatments
very
here in Mexico.
in Mexico. I know, and I want to talk to you about that because I think you're such a wealth of information. I mean, I've seen you speak and we've interacted. We had a great time at the last Congress in Thailand a few weeks ago, and watching you work as well, because you were involved with a live surgery workshop, was an absolute pleasure. I mean, one of the things you're really well known for, or what are you passionate, I should say, about, is long hair FUE. And so
Yes.
for people who are watching, long hair FUE is where you can perform a hair transplant surgery, but traditionally with FUE surgery, where we have to shave the back of the head, are now able to, with the new devices and the new punches that are on the market, you're now able to do these procedures without shaving the back of the head, which is huge. And look, I'm very much a novice at this. I'm starting out, but certainly not got the kind of numbers that that you're able to, and certainly the speeds that you're able to do. And look, I mean, assuming that that's a skill set that picked up over time. But talk me through how A, you got into that, and B, I mean, where are you at now? How many grafts are you able to harvest through the long hair FUE method?
Well, right now we are extracting an average of 1,500 hair grafts per session. My protocol it's based in surgeries that not allow more than 7 hours because of the safety of my patients. That's the main idea. Sometimes we have patients that need more hair in this cases of long FUE, and we make this 2 sessions each day consecutively. One day, for example, 1,500 grafts. Next day, the same. So we can make 2,000, 3,000 hair grafts or long FUE transplants in 2 days and 7 hours each day.
That's phenomenal. I mean, look, I think one of the best things about that, I mean, that opens up FUE really to a greater number of people. The downtime is going to be reduced, but also, one of the things I'm really passionate about is for women as well, because
Yeah.
traditionally with shaven FUE really puts a lot of women off. and really only then leaves them with the option of, if they, certainly if they have long hair, leaves them with the option of FUT surgery. But this now opens the door to certainly doing larger cases of FUE in a female while still allowing them to keep their hair long, which is, I think, is just going to be great, and it's where the industry is moving. How how was your learning curve with that? I'm dying to know, because I really want to know where the I know where the industry is now, where you are. I want to know how long it takes to get there.
Well, it takes me a lot of time. Well, but the thing, or the main idea of making a long FUE,
Mm.
started practicing long FUE, we always think of, and all the surgeons are afraid to some new techniques and all these kind of situations in the field. But I can tell you, longer view it's not difficult. Uh, Longer view is just matter of logistic and order. Okay, when I
Yeah.
start my practice in longer view, I start making small areas. I usually make this common short FUE, the shaped FUE, and I just in all my patients daily, I leave space of long
Yes.
hair, and I start taking my long hairs from there, and I started to get in more practice, more practice, more practice, being getting more order, and I start watching which were my weakness in this technique, and I started to improve it. I start to put my team to find solutions to make it more easy and at the same time faster. Because there are two things that you need to make or to get when you make this long FUEs, that you have to do it faster and you have to do it properly ordered. So I think those are the two main factors of the long FUE, or to have a successful long FUE practice. At the beginnings, I can tell you, I get uh, in 1 hour, I extract 200 hair grafts, 300 hair grafts of long FUE. That was my beginner rate. And then I start to practice and practice and practice. And nowadays, I already broke my own record last week.
Oh, really?
Yes, extracting 1,000 hair grafts in 15 minutes. In 15 minutes. In 50 minutes.
Really?
Not 15. No, 50 minutes.
Right. I
So
mean, that was achieving
I
short.
broke my yes, I broke my own record. So I think I can do it faster. I usually use the Fuse device, so that makes me surgery easy for me, especially
Yes.
making longer view. That makes me really easy to do it. You already saw it. You already saw
Yeah.
the
Yeah.
demonstration in Thailand. We were making extracting cutting long FUE as cutting a regular FUE very fast.
You were running behind in time, and then you went, okay, let me just quickly do this. And I was like, oh my God, that's the most amazing. You just suddenly, lit the fire and just blitzed through that. I was like, wow. And they were all beautiful graphs. It was such a joy to watch,
Yeah.
Alex. But listen, one of the things that I do want to ask you, because I think, um, I love the fact that you are just so focused on the hair transplant side of things, but you're also super, super passionate and very forward thinking about the medical side of things, and
Yes.
how we do that. And you've from our conversations in private, you've taken that, as I see it, to a different level, because it's not just, we all talk about finasteride and we talk about minoxidil, but you really incorporate a lot of these other things into your sort of toolkit. So just walk me through, just for the benefit of people that are watching, what are the
Yes.
big things that you are using now that you are seeing, really, really good results from?
Well, I think medical treatment is the future of hair loss treatments, not hair transplant. I think medical treatments, because when the civilizations and all this we advance, we try to make it more easy. for us. So I think the medical treatments are the main uh, that's the main solution for the hair loss problems. Right now, when I start my practice, I just watch but everybody was sending topical minoxidil, Propecia, and good luck. Continue with your hair transplant, and let's see what happens. And it was
Yeah.
like, okay, what's new? I think I can stay with that. I said okay, I need to research more. I need to focus more on the treatment because when I was making my first heart transplants, I had started having good results, but my patients had at long term uh come back to me and tell me, Doctor, I want another heart transplant. And I saw the patient as was like, okay, uh I saw you at the year. You were really good. Now you come 3, 4 years later, and now you lose the other part of your scalp. So what's going on with that? And I start making research. I was trying to prove and improve new medical treatments for my patients. There also I use new doctors, some dermatologists in different parts of the world, and I start debating with them about this medical treatments, and I start using drugs like dutasteride, bicalotamide, bimatoprost, and I was like, okay, there's a big world of treatments that all her transplant surgeons didn't know about it. All
Mm.
the there was like a new world was discovered by me, and this is the trichology world that all these medical amazing treatments, and then you start watching that. Okay, there's not only topical. You can use mesotherapy. You
Mm.
can use a lot of things. Usually, when I start my practice, everybody was saying, "Okay, PRP, PRP, PRP,
Yeah.
PRP." And nowadays, I tell you that when I start or before making a heart transplant, you have to be honest with the patient and you have to tell them, okay, androgenetic alopecia patients, example, it's a chronic problem.
Yes.
It's gonna be it's like the good marriage. It's for the rest of the life. That's what I tell to the patient. Okay, I tell okay, this is your condition. It's a chronic condition. That means that it's gonna follow you to the grave. Okay,
Yes.
so and some patients get disappointed, and it's like, okay, well, why do I make the hair transplant if I'm gonna lose the hair at the end of the day? No, you can make the treatment, make your hair transplant, and continue with the treatment, and you're gonna have very good results. You can get continue getting your hair because if you see some forums about they discuss this the hair transplant, they're like not very optimistic people that tell oh, why do you make the hair transplant? It's gonna fall out. You're gonna lose the hair. Oh, that doesn't work. You're gonna lose your hair transplant too. And it's not true. If you continue with this medical treatment, you can have a successful procedure and you can continue with the successful treatments. And all this new, well, not new because the medication was there, but it
Yes.
was not applied to the field of hair restoration. When I train, because as you tell, I train doctors. I receive in my clinics a lot of doctors that come and get trained with me, and I see two specific kind of doctors. Okay, the the surgeon, and the dermatologist. Two
Yes.
different, two different heads, two different worlds. And it's when the surgeon wants to fix everything with surgery. Okay, hair transplant. Put it on the hair transplant. We'll solid with the hair transplant. And the dermatologist, oh, we're gonna start a treatment for 2 years and see what's going on. It's like, okay, and my idea was like, okay, what am I doing? I'm gonna combine that. Boom.
Yes. Yeah.
Let's do it. I'm gonna combine it. So I start making this my protocols, my own protocols, and I start training my patients with the medications, and then making her transplant, and then continue with medications. And think, or I can tell you nowadays that some part of the success of my cases or of my patients is based on this. In the
Mm.
medical treatments, right
Yeah.
now, there are different options. Mesotherapy, to thyroid mesotherapy, it's marvelous.
Yeah, so
Bimatoprost,
I think this is a really important point, and I sorry, I didn't mean to
yes,
interrupt, but I think that's something that's getting a lot of traction. A lot of people are seeing really good results with that, with the dutasteride mesotherapy. I mean,
yes.
previously, we talk about dutasteride; it's generally all oral, but now to be able to give it locally and have its effect with, I mean, my understanding is, relatively limited side effects. Is that what you're seeing as well?
Yes, yes, of course. It's very important, and this is very nice because everybody that is listening to us is like, okay, don't take finasteride, don't take the finasteride because of the side effects. I can
Yeah.
tell you with mesotherapy, I don't have the the side effects of the oral medication. I can tell you that it's completely really it's amazing.
Do you, when you let's say you implement, and I'll talk about the other ones in a minute, but let's say you implement someone on dutasteride mesotherapy, are they still on orals at all? Like, for example, finasteride or propecia, or you just go, look, let's just try monotherapy with the dutasteride mesotherapy and see how you progress.
Important point. Thank you for taking that. I like that question. Before I start an anti-angiogenic medication, I make lab tests to my patients.
Yeah.
Why? Because which labs do I or what do I see in my patient? I start watching the prostatic history family too.
Yeah.
Okay, testosterone. There are all the androgens of the male patient.
Yeah.
Also, in well, female, it's a little bit more complicated because it's a world of hormones. But in in this kind of patients, you have to see how big is the hormonal charge. Okay, something really nice, and there's an article about it that explains the difference of using finasteride and dutasteride in the patients. We have two different kinds of receptors in the scalp for this the DHT, and the finasteride it's more specific to the crown area,
Mm.
and the dutasteride is more specific to the front and in the middle area. So it's really uh, interesting because now I see in my consultations daily, patients like, okay, I have 15 years taking finasteride. You have a marvelous crown, but the front line is it's missing. So, okay, we switch and we start to test right. Oh my God, this is amazing, doctor. The test right is working. Yes, because the test right works in this part. Okay, it's not never gonna work in the crown. No way. Forget it. It's not gonna work there.
So
And
even
there's an
dutasteride mesotherapy, you don't do it in the crown?
the test right mesotherapy in the crown. No, in the front and in the middle part. Okay.
Well, then do you do finasteride mesotherapy? So
Yes.
that's fascinating. I did not know this. So would you do testeroid mesotherapy simultaneously, and then finasteride mesotherapy in the back in one session?
Or you can send finasteride, okay,
Yes.
and apply just your mesotherapy of the thyroid here.
Right. Gotcha.
It's really good. So you complete. So now you can see this the important thing about knowing the medications because when you see how this is acting and how this is working, you start complaining that oh, I have been making uh, I have been making it wrong all the time. I was taking finasteride for 20 years and now I know that finasteride was only helping to my crown and well, maybe it's gonna help me a little bit in the front, but it's not gonna give me the same if, the same result of the same power effect of the finasteride, you know? So now I tell you, I start first I make my lab tests, then I select my anti-androgenic. If I have a patient that has been taking finasteride for a long time, I select the dutasteride, for example.
Yeah.
There are other anti-androgenics. There is bicalutamide. Bicalutamide, it's
Yeah.
beautiful. It's beautiful, especially
It's quite
in
painful.
women of, yes, it's beautiful.
It's,
For yeah, it's amazing. Bicalutamide in female patients for hair loss with this androgenetic alopecia, it's very effective. But talking or entering into the world of the hair loss in women, I think it's complicated because women are hormone bombs, and you have to study
yeah.
really carefully because you can see that, okay, what's going on,
There's
and
so many
something.
different there's so many different interactions at play. Estrogen levels
Yes,
going up and down on a monthly cycle, but also,
yes,
as in age, you've got that sort of perimenopausal, which is also a massive fluctuation, and then you get the postmenopausal or the menopausal dip. So it is a very complicated sort of scenario to try and work your way through.
yes, and something really nice. It's like I always tell to my patients, okay, and to all the doctors that come and get trained with me. It's like, have you ever seen these horses that are with like this, just
Yeah,
like,
yeah,
yes,
yes.
like
You
this,
can always
yes,
see.
are like this. Yes, I tell to my patients, you have to take out this and what to tell it. Sorry, I tell this to the doctors that come and train with me. It's like, take it out and watch everything
Yeah.
because people think that hair loss is a disease, and it's not a disease.
No.
Okay,
No.
it's a symptom. Okay, when that something wrong is happening inside the body. Okay, so which are the main places where you see when something is wrong? It's your hair and your skin. Your hair and your skin is talking about your body.
Yeah.
Okay, so when you are having this hair loss, it's because something inside your body is not in the correct way. So it can be a hormonal bad balance. It can be a metabolic problem. It can be an immunologic problem. It can be something related with our lifestyles too. Okay. So all these factors are the main problem of the hair loss. So yes, the genetics is also another part. But when you
I,
start studying
yeah.
these patients of hair loss, you have to focus in everything, in all this. And this is something very complicated. So this is when you start watching that treating hair loss is more difficult that we think about it. We
Yeah.
thought that, okay, we're going to send these drugs and the hair loss problem is going to get solved. No way. The
I,
hair loss problem is getting fixed by all this fixing everything.
I think you're absolutely right. I think, I mean, I've always said that one of the things that I love about this particular field is that it mixes science and artistry together. And,
Yeah.
previously what I was referring to is when we're performing hair transplant surgery, we have to incorporate artistry into that. We have to look at the design of the hairline, the flow of the hair, the angle, the nature, the curl, etc. But I also think, it is also about the artistry, about how we manage the patient. Which
Yes.
tools in our toolbox? Is it everyone just gets, a lot of finasteride and dutasteride or minoxidil, or can we, incorporate the other topicals? Can we incorporate the mesotherapy? But I think this is just gold for anyone who's watching. That look, it's about
Yes.
looking at, and the bit that I worry about, and this is, this is my soapbox, and I could probably stand on this and talk all day, and I certainly don't want to waste your time about this, but this is my worry when people look for a low cost solution, because they
Mhm.
can easily just go, they go somewhere and they go, right, okay, you need a hair transplant, you need, previously it was 2,000 grafts, and now places are going 4,000, 5,000, 6,000 grafts. We'll do it all in a day and done and dusted. and you're going, well, no, where's the, you've got to understand the mechanics of what's going on right now, what's potentially going to happen in the future, and be able to not necessarily predict it, but also preempt it, and also try and manage that. But I think, Alex, that's just awesome, and you're certainly one of the real pioneers. And I love the work that you do. I love both sort of from a medical perspective, the results with your patients. You're so super. And I mean, my favorite thing about you is that you're so super passionate about all of
Thank
this
you.
thing, and it's just really, it's such you're such a pleasure to be around. Now, look, I mean, I want to. This is one thing that always tickled me about you, because you've spoken to me about this before in the past, that you've performed surgery because you teach in a lot of different, all around the world. I think you've performed hair transplant surgeries in almost every continent, and I think Australia is still outstanding for you. Is that right?
Yes, absolutely. Australia is outstanding for me. I have made hair transplant in all continents in the world.
You have
Europe, Asia, America, all America. I have been traveled to all these workshops and perform surgeries in all continents except Australia.
Well, my friend, you have an open invitation to come and hang out with me here. It will be an absolute pleasure
No, no,
to
no.
to have you. So, look, like I said, you run the clinic MX Capillo. If anyone wants to get in touch with you, or talk us through where you're based. I know you're on the border of Mexico and the US there, but how can people find you if they want to sort of get in touch with you?
Yeah, people can find us between our networks, our social media networks. We can find us as MX Capillar or mxcapillar.com. It's the website. I think it's is the easiest way to contact us. And I think yes, this border situation. It's really nice. We are located in the board. We have two clinics. One clinic is in Nogales, this border with Arizona. The other clinic is in Ciudad Juarez, that is border with El Paso. So they can contact us. I think the easiest way to contact is by our website is mxcapilar.com.
No problem. And I'll put the link of or the sort of the website and your social media in
Oh,
the
thank you.
description below. But look, like I said, I've taken up more time than we'd planned, but I could listen to you talk all day, my friend. It has been an absolute pleasure. You really honored me by gracing me with your time. I'm really grateful. I know you're a busy man, and I know you've got a lot coming up in the future in your year. I know we will be missing you at the World Congress this year. I know you can't make it. I
Yes.
understand exactly why. You've got lots going on. So I wish you all the best, and I look forward to seeing you in person very soon. But thank you so much for your time.
No, no, no. Thank you very much, Dr. Vikram. Thank you for inviting me to being part of this amazing uh, event, and really honored to be here, especially because I think too much of the people that is watching us is going to
Yeah.
start asking, and that's our job. We have to educate patients. So I
Yeah.
think education is as you tell, which is the most lower cost treatment you can give to a patient. I think
Come.
education. I think
Yeah.
completely agree. I think education it will be the best treatment you can give to the patients, and it's we have to teach this to the future generations because when a patient come and I start giving all this treatment, they tell us, "Oh, doctor, that never nobody teach me how to take care of my hair," and that's true. When I was a kiddo, my mom never told me, "Oh, use this, and dry your hair like this." Was
Yeah.
absolutely we didn't have that. Nowadays we have all this education, all this social media. So I think it's really interesting what you are doing here, and I'm really honored to being part of this and to take me in count. We are preparing something nice with long FUE Afro, so soon
Yes.
we can talk about that.
I saw that on the program. So will that you'll do a remote presentation for that, will you?
Yes, yes, I will do it remote.
Yeah, and I saw that on the program. Listen, Alex, you're an absolute star. You're a good friend, and you're.
Thank you.
I mean, and this is in no order, and you're an awesome surgeon as well. So you hit the trifecta. Thank you very much for your time, and we'll speak soon.
Thank you for the invitation, Vikram.
Speak
See you
to.
soon. Take care. Bye bye.